is NBC Connecticut News at 11.
Well, sleep is essential for a person's health and well-being, yet millions of people don't get enough of it. Here to talk about the importance of sleep is Dr. Brimal B. Patel. He's a medical director of the Bristol Hospital Sleep Center. Doctor, thanks for joining me.
Thank you, my pleasure.
So what are the signs of excessive sleepiness?
Certain signs that you're driving drowsy, you're feeling fatigued during the daytime, you can't keep your conversations with people during the daytime, you're always feeling you're getting tired during activities that you're doing, you can't keep up with things, certain times social obligations you can't perform.
And when it comes to how much sleep we need, I believe there's no set number. Doesn't it just vary? Because, for example, I need about 8 hours, if that, 8 or 9 hours of sleep. Some people can go on 5. I mean, it just depends, right?
It truly does depend. There is a thing called actually having patients with having sleep short syndrome. So basically, if they're sleeping less than 6 hours, that's normal. There are people with a long sleep tendency, more than 10 hours. Normally, generally speaking, 7 to 9 hours of sleep is what we require.
The idea that as you get older, you need less hours of sleep, that's not true, right?
No, that is not. That is incorrect.
Okay, good. We're going to make sure that we know that about that. Now, on this National Sleep Awareness Week, it's important to, point out what causes sleep problems. What is it?
Certain things that sometimes it's behavioral things for especially teenagers when they're going through school and stuff. They're with friends and they're actually looking out for their parties and social lifestyle. So certain times it's that. Sometimes it's because of their anatomy. Oropharyngeal airways are sometimes narrowed. Sometimes it's their obstructive sleep apnea that may be acting. They may have obstructions when they're sleeping, especially at nighttime. Other times it could be narcolepsy, something of that nature, where people have this tendency to just fall asleep and they're actually sleep deprived.
So let's talk about the consequences of lost sleep and what we can do to kind of alleviate that and rectify the problem.
The consequence of sleep-related problems, any sleep-related problems, is, first of all, your productivity at work is going to go down. More chances of you getting involved in a motor vehicle accident or any other type of accidents. You're going to have symptoms, which is like headaches, chronically headache. You're going to wake up with headaches. You won't be able to perform in social activities like I was alluding to earlier. These are certain consequences of the sleep-related problems that people face day to day.
As far as treatment is concerned, what are their options? What are people's options? Obviously, sometimes it's not as easy as just saying, you got to sleep more. Sometimes it's hard.
I agree. The treatment kind of depends on what kind of problems there are. There's over 80 different types of sleep-related problems.
Really?
Defined by our Academy of American Sleep Medicine. So it kind of depends on what they have. The most common of that is obstructive sleep apnea. And there are a wide variety of treatment options available, from surgical options are there. Sometimes positional therapy, just telling them don't sleep on your back, kind of helps them. Majority of the time, though, the treatment of choice is still considered the positive airway pressure, which is the mask that people actually think about, the CPAP, the BiPAP, and then we have the other types of mask devices, ASV, and things of that nature.
How have you seen patients' lives change from just getting a few extra hours of sleep at night and, again, fixing the problem? How have you seen them just, turn around?
Well, actually, the funny thing is sleep medicine is one area where a person's life will change dramatically within the one night. So if the person's not getting sleep and they're having fragmentation of their sleep during the nighttime, and you treat them, you put them on first of all, you diagnose them with something like sleep apnea, for example, and you treat them. Then now they're relieved of their obstructions during the night. They're sleeping throughout the night. Yes. They're getting that deeper part of the stages of the sleep that they need. And they're more alert, more able to do more work during the daytime. And they're actually more energetic. And so, and myself, I know when I was training in my residency, I was diagnosed with sleep apnea myself, and that was the reason why I actually entered this field.
That's interesting. So, you buried the lead there. That's an interesting story. So, I mean, you yourself, you suffer from that. So, very interesting. And, of course, if you find that you have a problem or you're just kind of curious, it's always best to ask a physician such as yourself. Dr. Patel, thank you for coming in.
Thank you very much.
We appreciate it. Well, still to come, more than tummy troubles, how a mother's